All right, hello. Thanks to everyone who's been hanging with us all day. This is the last session for the summit, but I don't know if we mentioned this. So all of the sessions, even from yesterday, are being recorded. So we will be working on like getting all of that uploaded to the platform. And whenever you have access to the platform like what you do now, you have access to that for 30 days. So if there's any sessions you miss that you want to go back and watch, you have 30 days to do that on the platform. But after the platform is closed, like officially, then we will be moving all of that onto our YouTube page. So you will be able to watch it at all times. But this is our last session. Like I said, this is mental health and stigma in diabetes. We have amazing panelists to be able to talk about this. So Mary, I'm just going to go ahead and pass it off to you to get started.
Hi, everyone. Thanks for being part of this group. For those of you that know me personally, you know that I love all things mental health and empowerment and talking about self-love. And we have these amazing panelists that are going to introduce themselves. And then I'm going to be asking the panel a few questions, and then you're more than welcome to join. We really want it to be like a round table. So if there's any support that you need or any questions that you have or support that you can offer the rest of the group, that's awesome. I think it's really great to speak from our experience and what has helped us as a whole. I'm going to start with you, Lucy. Introduce yourself.
Hi, everybody. Well, I'm Lucy. I'm Spanish and Argentinian, and I have been living with type 1 diabetes for 30 years. I'm a lawyer, but I'm also a passionate advocate for every person living with diabetes. And I believe in the importance of mental health to treat our condition properly.
Thank you.
Nice to meet you all.
Yes. Crystal?
Hi, everyone. My name is Crystal Diaz. I'm a recent graduate from the University of California, Davis, with my Bachelor's of Science in Global Disease Biology. And I'm hoping to go to PA school in 2024. I currently work as a GI tech at the University of Irvine Medical Center. And I've had type 1 for 3 years. I was diagnosed at age 18. And I'm just really passionate as like a woman of color and of Chinese and Filipino descent, just amplifying BIPOC voices and amplifying Asian American voices has been really important to me.
Okay. Thank you. Brandon?
Hello, everybody. My name is Brandon A. Denson. I've been living with diabetes close to 20 years, so 2 decades. I am a creator, entrepreneur, and also a diabetes advocate as well.
Thank you. Okay. Lucy, I'm going to start with you. I know that you have a passion for mental health, and the question I have for you is, why is diabetes and mental health so important for a person living with diabetes? Like, why is it so important to talk about it?
And well, I have the experience, and I think that it's not that mental health is important to treat diabetes. It's not just that. It's that mental health, taking care of our emotions, is the treatment for diabetes. Because imagine that you are not in the mood to take care of yourself. You cannot take care of your diabetes in those conditions. And living with diabetes is hard enough. You have to accept that. You have to go through a process, and then you have to be constant every single day of your life. That's a long time. So absolutely, I believe that taking care of our mental health is the treatment for our diabetes.
Yes. Yeah. And Crystal, what do you wish providers would have done differently in setting you up with mental health resources when you were first diagnosed?
Yeah, since I was only diagnosed 3 years ago when I was 18, I was seeing a family med pediatrician at the time, didn't have an endocrinologist yet. And I remember circling on those different mental health forms, all those different forms that you first fill out when you see a new doctor, that I'd been experiencing suicidal thoughts and feelings of depression. And he did acknowledge in the room that, like, hey, you're going through this, like, I understand, gave me a list of resources. But that was kind of like where the follow-up ended. And I wish I had stronger follow-up, and those resources were just support groups, and I didn't feel comfortable with talking about what was going on in my head with other people yet. And so I think forming a treatment plan with your patient's input is really important, because with their opinions and with what they want to do in that treatment plan, they're more likely to take action to it and then actually improve their mental health and improve their diabetes care. And so I wish that was what my doctor did at the beginning. So then I could have had higher A1s or lower A1Cs earlier, and just been more confident in my diabetes overall.
Yeah, and that's such an important point to make as well, just because some folks might be, when we think about support and mental health, someone might be like, I really like the privacy of the one-on-one. Some folks feel empowered and supported, and perhaps even less lonely if they're part of a group or a community group where they're like, okay, yes, you're going through this too, I'm not alone. But I know that folks also are like, I really want this to be one-on-one because I feel more supported, more safe this way, which is really, really important thing to consider as we consider our needs for mental health. So yeah, thank you for sharing that. And Brandon, what do you feel like, not just our endocrinologists, but maybe families, when we're talking about like working with men or teens or boys and their mental health? Because I think your perspective is really important. I know that you work with men through Bolus Maximus, and you've been a mentor to youth for a very long time. So just that piece of, for parents in the room, for maybe for women here in the room that are working with teens, with boys.
I think mental health is important for anybody, not just people living with diabetes, but I think, being, especially those teenage years, those are very important years for everybody. But boys and girls can be challenging, but boys, I think it's more, I have to fit in. So I have to do what everybody else is doing. And I also think of coming from a single parent background with just my mother. I had a lot of mentors. So having a mentor definitely helped. I think prior to diabetes and after diabetes, being able to have people that understood me and that took the time to understand me. But it is challenging, for parents that are caregivers for their kids. It's tough, especially, like I said, with those young men. You have puberty, you have liking girls, you have all of these different things. But I think if they have somebody that they can genuinely talk to about things that are going on, I think that kind of helps the mindset of helping live with diabetes.
Yeah, that's great. Yeah, because I think that is like, just looking at it from that perspective of, this is the mindset that someone might have, or like, I shouldn't have help because I should be strong, or, all the things that we're socialized to believe as men and women, and as folks that identify in different spectrums of our gender, right? Like, what am I being told about how I should be in this world? So really paying attention to that is so important. Thank you. And Lucy, how would you encourage folks as they are working on maybe improving their emotional well-being?
Well, I think that it is important to be part of the diabetes community. I think it's really helpful, and some people, especially in the beginning, do not reach out to peers. Peers are a valuable resource to feel better, to feel that you are not alone. And then you start meeting people who, like you, live with diabetes, and that changed your whole world. At least that's what happened in my case. Because it was a great difference how I felt before finding the diabetes community and how I felt afterwards. I became a completely different person. And I think that could help most of us. At least we realize that we are not alone, that we are struggling with this disease, but it's not just us. And you get a bigger picture of everything.
Yes. Yeah, I think that definitely resonates with a lot of us, no matter what age we came into diabetes, but also too, I know that I came into the diabetes online community well into my 30s. And it would have been lovely to have known the types of communities out there, even in college, I think would have been very, very helpful. And Crystal, I love this question. What advice would you give family and friends of a person with diabetes experiencing a mental health crisis?
Yeah, I think just understanding that diabetes has ups and downs like any other mental health crisis going on. I think for me personally, sometimes I'm like 100% like, yay, diabetes. I love like everything about it. Like it empowers me. But sometimes I feel really down about diabetes. Like, gosh, do I have to bring my PDM and sugar tabs and all these different things? And so understanding that diabetes has ups and downs and just being there to support throughout that entire journey is really, really important.
Mhm. Yeah. And Brandon, like, what do you feel providers may often overlook when they're working with men or teen boys as they're supporting them through diabetes?
I mean, I think it's one of those things, like you said, right after I spoke, I think in society, men are supposed to be strong, and the emotional aspect, or having feelings, or showing signs of, I guess, weakness. But it's not really weakness, as I look at it. Sometimes, like, oh well, he's a guy or he's a boy, he'll get through it. And yeah, you will get through it, but it's like, it's the matter of how you actually get through it. And I think sometimes it's like, hey, let's backtrack a little bit and kind of see what's going on. Let's double click on some of the things, whether it's things going on in their life specifically that don't have anything to do with diabetes, or that do have to do with diabetes. I think it's just understanding, taking that time to understand the patient. But those 30-minute visits don't always, you can't do so, you can only do so much in a 30-minute visit, and that's the reality. So I think when we say, like, what could somebody do, I think spend more time, understand who you're dealing with, especially when you're dealing with kids or teenagers, but also adults. You have to know who you're dealing with. You have to peel back the layers. And, a lot of times that doesn't happen. It's just a number, and then you're getting pushed along. And that's anywhere from kids all the way on through adults. So I think the main thing is that what gets overlooked is, I think, the time aspect that goes into actually caring for the patient.
Yeah, because like you said, sometimes they're like moving quickly, our providers, because of the medical system and then the way it's structured. And then there's a piece where they're just focusing on, like you said, time in range, A1C, and then they're not considering, like, is this person properly resourced? Maybe their struggle is outside of diabetes and it's something personal, or maybe they're struggling with financial difficulties or community. So how do we resource them? And I think sometimes that is a way to kind of look at it, not just like this person has diabetes, and then how else can we support them? What's that missing piece that maybe we're not really looking at?
And I also want to add this. You said something in regards to, like, the numbers, right?
Mm-hmm.
A lot of times we know the numbers. We can look, it's data. It's all data. So we can look at a Dexcom, we can look at our Freestyle or our Eversense, and all of these different devices that we have to track these things. But, the main thing is the endocrinologist or whoever we're seeing, because some people only see a primary care physician, unfortunately. But they're just looking at the numbers, and the numbers, when you understand data, there's a story in between that, highs and lows and everything in between. But if a doctor isn't really understanding why you're having these highs and lows, other than just making adjustments, then that's where a lot of the issue lies. And like you said, there's so many things. It's stress, it's financial, it's maybe even somebody getting to and from an appointment, that people can be affected by. So yeah, I mean, it's just a lot of stuff that goes in between those highs and lows. They're not just numbers. They're things that are actually happening in people's lives.
Yes, absolutely. Thank you for that. And Lucy, what has why is diabetes burnout and talking about that so important? And like, what are supports that you've used for yourself in kind of being aware of it and like caring for yourself and nurturing yourself?
Yes, well, diabetes burnout, as we all know, is a stage where we find that we are over and done with diabetes, that we don't want to live with diabetes anymore, that we're just tired and taking care of our diabetes every day. And sometimes the numbers are not the best despite our best efforts. So it's complicated, and I think it's quite human and normal to experience these feelings. And this burnout shouldn't be considered a diagnosis like, oh, you're experiencing burnout. Well, we have to understand as humans, using our empathy, that any person living with diabetes would be feeling really similar things if they were you, because it's not easy living with diabetes. It's not easy to experience hyperglycemias and hypoglycemias, and having diabetes messing up with your life and with what you want to do and with your health. You want to feel good, and then bang, diabetes comes. I think that we should validate our feelings when we feel we are going through burnout, and understand that it's normal, and be kind to ourselves. And try not to force ourselves to be perfect all the time, because perfection is impossible, especially with diabetes. And yes, be kind to ourselves and take the time we need to validate what we are feeling, and understand that nobody wants to live with diabetes. Not like I'm being a bad person because I'm tired. And I can never be tired. It's like very similar to what Brandon said about men. No, men can't complain. Men must be always strong. We don't have the right to complain. Well, the same. We have diabetes, and we have to understand it's not easy, and it's okay.
Yeah. See, and I think that I see that with a lot of folks, right? Where we are so great about being compassionate with other people and their struggles, but when it comes to ourselves, we're like, well, you suck,
Absolutely.
you're not strong, you're not doing it right, or you're not strong enough, or
That's a challenge.
yeah, we have that negative self-talk. Rather than also, like you said, I'm going to validate it. I'm going to slow down and nurture myself so I can keep going. Because that is very hard, especially what we learn about disability, what we learn about what diabetes means and the stigma around it. So there's definitely a process, I think, for all of us of unlearning all those things we learned about what diabetes is, or what living with a disability is, and rethinking how we live with diabetes for ourselves, I think, is also very important. But I appreciate you sharing that. I did want to ask Brandon and Crystal too, like their experiences of burnout, and you don't have to be like super detailed, just like what has helped you in the process, and just like that piece of, okay, this is getting hard, I need to slow down. Like, how do you guys help yourselves and those experiences?
Yeah, I can go first. Yeah, I think I had like the most severe diabetes burnout at the beginning of the pandemic, especially as like a student transitioning to online school. Then it was like within my first year of having diabetes, so just trying to figure it all out still. And so I think like journaling helped me a lot to just get what was going on in my head onto paper. And then I was also getting involved with the diabetes community at the time. And so talking to my diet buddies really helped, and because they understood what I was going through, and they were college students going through the same thing. And so that helps me a lot.
Yeah.
I would say most importantly, I think finding the diabetes community. I didn't find it, it found me several years ago, but it's a good thing. But I also think things that help me is that I'm a co-founder of a nonprofit, Bolus Maximus, and even though like I go through burnout, like being able to help other people, like really makes me understand and makes me feel good even when I realized that I do have burnout, I was like, I'm helping other people that may not have had the community or the resources for right from the beginning. And outside of like tapping into the diabetes community, my brother from another mother, my co-founder, Matthew Terrell, I'm able to bounce a lot of stuff off of him because he lives with type 1 diabetes. And then also like, I'll just like to do things, I don't want to say weird because nothing's really weird. If you like it, that's your thing. Like the rollerblade, I like to go on walks, I like to listen to music, I like to take pictures. You know, all of those things that just kind of, I guess, help with the burnout. But the burnout is inevitable. Like it's going to happen. I don't care who you are. You could have been living with this for 60 years or 3, you know, like the reality of it is at some point we have so much going on in our everyday lives that it's damn near impossible to like just for things to always they're never perfect. Like you mentioned, Lucy, nothing is ever perfect, but we're always going to run into being burnt out or having to think about having a PDM, or did I bring my Dexcom, or you know, did I bring extra insulin, and all these things. Like it's just going to happen. And then also not just for us, for caregivers as well. You know, that's another major one, you know, far as like people running into that burnout.
Yeah, and that was a great point that I saw in the comments about how sometimes our technology can be a source of stress. So I'd like to, for those of you that use technology, because I didn't ask you beforehand, like what has that experience been for you, like the pros and cons? I know for me personally, I was MDI for a very, very long time, for most of my life as a diabetic, and I've been diabetic for 34 years. And I didn't begin using tech until I want to say maybe 2016 or 17. So for me, I think it had the opposite effect where I was like, oh, I can breathe better. And those beeps are annoying from time to time. We're like, I was trying to listen to that song and really enjoy myself and move with the music, but then it beeps and you're just like, great. But for you guys, like what has tech, like how has it supported, and do you find it more helpful than draining? Because I know some folks that I've worked with where they prefer like MDI. They're like, I can't do this tech stuff. That's actually more overwhelming. So just wanted to hear your thoughts on that.
Well, in my case, I'm a technology lover. And since I use technology, I'm very happy to be able to use technology because in many countries, that's a privilege and not everybody has access to it. So in the first place, we must be thankful for what we have. And I think the advocate so that other people can access these valuable tools for managing their diabetes like we do. In my case, I feel physically better and I have a better management of my diabetes since I use technology. It was a great change in my life. Obviously, when I manage my diabetes better, my emotions are better and I'm happier. So, well, sometimes, yes, sometimes it can be tiring. You're using technology and then hypoglycemia, and then you see the arrows, you start getting nervous. But I think that the advantages are more than the disadvantages. That's for sure.
Yeah. And what about for you, Crystal?
Yeah, I started with finger pricks and insulin pens. And so transitioning to a Dexcom and Omnipod was like what I absolutely wanted because I since I was 18, I was new to college when I was first diagnosed. And so I didn't really want to show people my diabetes. And so having to say like, oh, I need to go to the restroom to go give myself some insulin was kind of embarrassing. And so, or for me at least. And so I think having those devices is really an advantage for me, like not just like in my diabetes management, but also for my mental health, because I wasn't embarrassed about going to give myself an injection or doing anything like that. I could just do it with the PDM or check my sugar with the Dexcom on my phone, and it's really discreet. And so I think that was helpful in both my diabetes management and my mental health.
How about you, Brandon?
I have a love and hate relationship with technology. I gotta be honest. It's just like any technology, right? When it's good, it's like amazing. But
Mhm.
when it's not quite working like one you need it to, or it's falling off, or you can't get your supplies on time, or it's so many. It's like I'm like 50-50. I'm conflicted because when it's, like I said, when it's good, it's amazing. It's like, oh man, this is. But when you don't have it, you get so used to it, and it's like, okay, now what's going on? I got to do this without my CGM. Okay, it's like I got to walk around without my glasses on. I got to kind of figure it out, But I'll honestly say, when I was first diagnosed, I found out about like insulin pumps. And I used to be very, very active. I played 4 sports in high school. I played football at Michigan State and graduated from Michigan State University. And my first time hearing about an insulin pump was in 2004 when I was diagnosed. And I remember the nurse telling me about it, and she was like, yeah, they have this little machine and you can just type it in and then it gives you insulin. And at that time, back then, they wanted you to live about a year with diabetes before giving you something. So it was like where we're at now, it's kind of like, oh, well, yeah, insulin pump, CGM, I think it's amazing that people have the chance to use the technology, because out the gate, if they want to, they can try it. If they, if they have insurance and the insurance pays for it and covers it, they can. So I would, I would suggest anybody that has the opportunity to use technology to help them manage this disease, at least try it. And if you don't like it, you can always stop. But I'll be completely honest. The technology, just in any phase of life, I've always been interested with computers and tech and everything. And the moment I was able to get an insulin pump, especially playing football, it just really helped me out. It helped me. I just have more flexibility, for me personally. And like I said, everybody is their own person. Some people like CGM, some people don't like them. Some people like pumps, some people don't like them. Some people prefer just MDI, but whatever it is, just try it. Don't only listen to what people say, try it. And you always have the option to stop using it if it doesn't work for you. But I'm still 50-50, because sometimes you have to go back to the old school method of doing things.
Yeah. Yeah, I know. I hear folks say that they take breaks, right? They're like, I'm taking, it's like, I'm getting off the technology and doing a pump break or a CGM break. I do pump breaks personally from time to time, where I'm just kind of like less things off my body. But I think I'm more in like that 80-20 stage, where I'm like, I love you, technology, and you're making things better. And those percentages where things are off, I'm kind of like, oh, this is throwing off my day a little bit. But I'm more on the side of, for sure, personally, of being really thankful for the technology that came into my life a little bit later. And I have another question for you, Crystal. I also love this question where you asked about mental health and diabetes stigma, and how having that group support, that peer support, creates betterment. So how does that group support reduce that diabetes stigma?
Yeah, I think Lucy kind of touched on this earlier, where she talked about how getting involved with the community changed her life. And I would say the same too. Like, it's absolutely improved my diabetes care, my mental health, and just overall my social confidence in diabetes too. Like, I'm here talking to y'all. I wouldn't be here if it weren't for that.
Yeah, and 3 years in, you said. So that's, that's amazing. Yeah.
And so, yeah, I think just being surrounded with people who are going through the same thing has meant so much to me. And the intersection of mental health and diabetes is unique to people living with it. And so just being surrounded by those people who fully understand and fully like get it, like is super, super important and absolutely vital, I think. And I wish that I had gotten involved earlier, if that were possible.
Yeah, I second that. Well, yeah.
But yeah, I think it's absolutely changed my diabetes journey. And yeah, peer support is important.
Yeah. And this is a question for all three of you. And in regards to stigma, what were like some things that you like had to unlearn about what diabetes was and that stigma entailed. Because I know that we've all had folks say like, oh, you can't have sugar, or diabetes is bad, or you have the bad one, or, just like all the, kind of the lack of education and information, the right information, that sometimes people make assumptions that create stereotypes, that create stigmas around being diabetic in general. So what were some of the things that you felt like I had to learn this thing about diabetes?
Well, in my case, I would like to say that in the first place, the worst stigma I've ever experienced because of my diabetes came from myself. I didn't want to accept that I lived with diabetes. And I was picturing horrible scenarios in my head that living with diabetes would make me different to other people. So I was trying to hide my disease. So I wasn't managing my condition well, obviously. And that took me a while to learn that my thoughts were wrong. That was not like that, but that's because I didn't have a community supporting me. And it's something quite private, because it's not something that you talk openly with people. Hey, I've just been diagnosed with diabetes, and I feel that I'm not like the rest of you people. I felt that it was something bad. And it took me many, many years to unlearn that. I think that we should be offering resources to people to feel that they are not alone and that it is okay, and to talk openly about diabetes.
Yeah, because I think I hear a lot, especially when I'm working with youth, oftentimes, where they're like, what are my friends going to think? What are people going to think? What about the person that I like? Are they still going to want to date me? Right. And I saw this other question, I think, by Barbara. And thank you, Brandon, for answering the question. But she asked, how do you work with youth who don't like tech or to show it on their body? So I know some, for me personally, I purposely wear it where people can see it, just to normalize having a medical device on my body. And I'm okay and happy to answer questions at this stage in my diabetes journey. So I purposely do that just to educate people. And I think about like younger folks that I work with oftentimes, and just to create ease for them, I purposely wear it where it's very exposed. That because I sometimes get comments from folks that I work with where they're like, yeah, that someone just kept staring and it made me really uncomfortable, but I didn't say anything. And if I can create ease, I'm happy to do it. But what was that experience for you, Crystal? Like being new to technology, like did you hide it? Are you more open? Because there's no right or wrong way, right? Like you can wear it somewhere where it's enclosed and no one can see it. And then for other folks, they're just like, I'm diabetic, hear me roar. And that's also okay.
Yeah, definitely. I think, well, recently I started a new job, and I think this is a good anecdote to start with. And so I wasn't really feeling diabetes for that first week. Like I didn't want them to question like my capabilities. I didn't want them asking questions. So I hid it like up higher on my arm where they wouldn't be able to see it. But I later told them, because I'd been experiencing lows with the new job, like later lunch times and things like that. And so I'd been experiencing lows. So I thought it'd be important for them to know that I had diabetes, like this is going on. And so I talked about what DKA was. I talked about how my symptoms were and things like that. And so soon enough, I mean, it's inevitable. There was like cake in the break room. They were asking like, if you want some. And then my coworker's like, oh, can you eat that still? And I already knew the question was coming. But I used that opportunity to be like, yeah, of course. Like I just have to give myself insulin and I'll be okay. And so like using, like you talked about, like using diabetes stigma as fuel and as like an opportunity to educate rather than something to bring me down is kind of the way that I've overcome overcame diabetes stigma and those silly questions. But it's really like they don't know. And so you got to take that as an opportunity to tell them and educate.
And what has that been as an experience for you, Brandon, with like destigmatizing the idea of diabetes or like technology, and maybe giving us a little insight about maybe some of the youth that you worked with and what you talked to them about?
I think one of the biggest things from, I would say when I was first diagnosed, it was interesting because I had to look at things a little bit differently. At that time, I was multiple daily injections, and I was checking my sugar. I had teammates looking at me crazy. I'm in the lunchroom, but like a lot of you said, like I use it as I use it to actually educate people on like what was going on, and then that kind of opened up bigger conversations on like, oh, well, my grandma has it, or my uncle has it, and so for me, the stigma is, I think people, if they don't know, I mean, this is just human nature. We're going to look at something if we don't know what it is, we don't understand what it is. But I think for me, I never get mad. I just, that makes me I get a little excited about it, because it's like people, they'll ask and like, what is it? And it's like, oh, I didn't know that that's what that was. Like, I seen somebody else wearing one and I didn't know, but like a CGM or an insulin pump. But for me, I always looked at it as like fun and games, and because like some of the stuff I would hear from my joking teammates and friends and family members, like to me, it didn't bother me. It was just like, oh, you got a pager on. It's like, oh, we haven't seen one of those in a long time. But I think just the overall stigma of this is just something that that helps me in regards to like just bettering my diabetes, for the most part. But then also on the other end of it, I think it makes people really realize what we have to go through living with diabetes, on the other end. Like it is jokes and it's games, but I think they see like the resilience of somebody living with type 1 or type 2 diabetes, and they see like, oh, he has to put this on, or he has to give himself shots, or he has to wear this all the time. It gives them a different perspective on like, dang, I could never do that. And it's like, you say that until you're actually in that situation and you have to, so.
Yeah. And I think that's why, like, we're all kind of saying collectively that we, in our comfortability with diabetes, some of us are like out there educating, and other folks are still kind of working on their process of what feels good for them in their body, living with diabetes. Have you ever encountered within yourself, like, and this is a question for all of you, just like feeling different with your body, or with wearing a medical device? Because I know sometimes when I'm working with folks, they're like, I just feel like I might not be as attractive, or does someone still want to date me? And I'm like, yes, of course I do. You're beautiful. You have a great personality. Like, you're awesome. But like, what has that been experienced, and just kind of adjusting your body and your mindset to like, I have this contraption on me, or this device on me. I know with some younger kids that I work with, they're like, I'm part robot. And I'm like, yeah, that's great. And that's how they normalize it. But what has that been experiencing with that, just that body acceptance and your medical devices?
Well, in my case, I'm very happy with my insulin pump on CGM, and I could also say that I would feel worse if I didn't have it. So of course it doesn't accept my body image at all. I'm actually happy. It can be uncomfortable sometimes. For example, if you want to go swimming, but practical stuff, not that anything changes, because your body is your body. You're still the same person, just wearing your medical device that keeps you safe and healthy. So what's the problem?
Yeah, I love that. What about for you, Crystal?
Yeah, I think I was diagnosed at 18, and I lost a bunch of weight like we do with DKA. And so I also like battled like being 18 and being like in puberty, and then also that whole entire stigma of like freshman 15. And so of course, like I gained weight once I was back on insulin. And so not only was I battling like body image, but also like wearing devices on my body now. And so that was like a really tough time for me. But I think just realizing the benefits of having those things on my body, seeing like my A1C like decreased drastically from when I was diagnosed in the emergency room, and just feeling way better, not having to go to the restroom all the time, and just not feeling tired all the time, just really like helped me realize like, okay, like I'm healthy now, and this is what's going to help me just feel better overall.
Yeah. Yeah. I can definitely resonate with the bathroom thing. I think that there was a point like, I want to say maybe like my junior to senior year of high school, where I was kind of like, I'm done going to the nurse's station. I'm done going to the bathroom. I'm like, I'm just going to do this right here at my desk. And that was something that just felt right for me. But I know for other folks, they're like, I like my privacy, and that's okay too. Yeah. And I'd like to just talk a little bit more about mental health resources that have been helpful for you. So if it feels comfortable for you, like has therapy been helpful, group support, those kind of resources, or maybe like directories that you've looked like specifically, or organizations that have been helpful for you, just to have more resources for the folks watching today.
Well, in my case, I work at Beyond Type 1, and we have an amazing library of mental health resources, among other wonderful resources. So I invite everybody to visit beyondtype1.org, and they have fantastic things.
Thank you. What about for you, Crystal? Is there anything in particular? I know that when we're in college, oftentimes mental health resources are free in the college setting, or they have resources in the community for college students. So has any of that been helpful?
Yeah. Yeah. I did the free therapy thing just because it was free, and I was going through it too. But that helped a lot. But I think what benefited me the most was the community, of course. Shout out to my friend Allison here, who is online. But she co-founded the Subtle Asian Diabetics group on Facebook. And I think with that intersection of having diabetes and being Asian, that helped significantly, because there are like people who looked like me, people who are going through the same thing, just experiencing all of it all together. That just helped me so much. And yeah, it's nice to have diabetes.
Yeah, I agree with that. And definitely having folks that look like us. I know that me working, being Mexican, being multiracial, it is important to have people in spaces that understand my culture, that understand that duality. And would you mind dropping the link of that group that is Asian specific, because that could be like a really helpful resources. I didn't know about it, so that's great for me. Another resource to add to share with folks that I work with. Okay. And I know you kind of dropped off for a second, Brandon, but I'm just going to go back to that question about just like body image and wearing medical devices on your body, and just like from your perspective, or like youth that you've worked with, men, boys.
I think it always comes up, but for most of the young men and teenagers that I've worked with, it didn't really bother them. More so for like teenage girls, they were more so, I found them more so like trying to hide things and not wanting to show things. And, I think it affected maybe their mental state, and they think that it affected their body image. But when I did see those type of things, I was just like, it's cool. Like, don't worry about it, but also when you're telling them that you feel comfortable with it, right? They may not feel comfortable with it, but you sharing that it's okay, that they'll be fine. Like, And if people are making fun of them, then those probably not the people you want to be hanging around, especially like if they're your friends. You know, we all understand if it's a joke, it's a joke. But if it's something that's hurtful as a joke, you know, then those aren't the people that you want to be around. I'll say for me personally, when I first got my insulin pump, I thought it was the coolest thing ever. And then, you know, I guess I really started to understand what it really was like. You know, I'm in the locker room with 130 guys at Michigan State. So like it just raises questions in their accent. It's just like, it was all cool. You know, they wanted to, they made sure I was good, you know, and that was kind of like my fear of like, well, I'm gonna show them and I'm being very vulnerable, you know, and then, you know, I guess as you get older, you start having sex and things like that. And then I think that was my second encounter of actually like being like, how is this going to be taken? You know, and it was like, well, regardless of how it was taken, like Lucy said, at that point, it's a part of me. So if they don't like it, then you got to hit the door, you know, you got to go, you know, it is what it is. You know, I'm doing what I have to do for myself. And I think most importantly, that's probably the message I would give to any teenagers that are kind of fearful of showing it or feeling like they're different or anything like that. It's like, look, at the end of the day, you know why you're wearing this device, you know what this device does for your life. And that's all that needs to be said on that, you know. So it's just, you know, people, it takes a little bit longer for them to feel comfortable with things, but hopefully a lot of these teenagers and even adults, you know, they become comfortable on sharing themselves to the community for, you know, what it is, you know, because they aren't the only ones that are going through this.
Yeah, absolutely. And I second that. If someone's like, I don't like this about you, thank you for letting me know, goodbye. But I know that, especially like working with, like you said, youth, that can feel a little bit harder, right? When they haven't fully identified their self-worth yet, right? And see their value yet, where that might feel a little harder, where you would want to be flexible or adjust to another person. So just even normalizing that, especially for those of us that are older with diabetes, that have lived with diabetes through those younger stages, where we can definitely normalize it for other folks in the community, I think is so important. And I wanted to ask you guys just about some of your self-care practices. I know we talked about burnout just a bit ago and how like there's an availability to it where sometimes you're like, it's going to happen. I haven't been taking as great care of myself as I usually do. So just wanted to hear a little bit about like your self-care practices that kind of help you reduce that burnout or that just nurture you. I know for me personally, being in nature a lot, as many of you know, hiking, taking walks is really, really important. So is social connection. But what about for you, Crystal, if you can just share just what helps you? I know you earlier in the conversation, you had said journaling has been a great component.
Yeah, I think journaling has helped me a lot, mental health wise, but I think my newest thing has been going on walks and listening to podcasts. But sometimes diabetes gets in the way of that. Like I'm already trending down and I don't want to go on a walk where I won't have access to sugar. So I think another thing I've been doing is just reading a book, classic. But it's nice to go back to. But yeah, just anything to kind of like relax and unwind, I think is like a good form of self-care.
And what about for you, Lucy? Like what are some of your self-care practices?
I agree with you that nature helps a lot for sure. And also I tried, if I'm not feeling well, I try to avoid isolating myself. I try to stay in touch with my peers because community always helps, as we were discussing earlier. Also, I think in my case, it's very important for me to listen to my body and validate what my body has to tell me. For example, sometimes I get tired very soon. Well, I have to listen to my body and rest a bit, even if the others don't. And when I listen to my body and I rest, I feel better and it's okay. Maybe other people have more resistance or things like that, but validating my body helps for sure.
Yes, that's a great practice to have for any of us, whether or not we're living with diabetes, just to really pay attention to our body Do we need to move it? Do we need rest? Do we need nutrition? Are we hungry? When was the last time we drank water? So even basic things like that are really important. How about for yourself, Brandon? I know that you rollerblade.
Man, yeah, I love to skate, roller skate, rollerblade. I like movement. You know, if I'm not completely still, then I love movement. Crystal said something that was like, I get in the mode and it's like, hey, I'm gonna go rollerblade today, and it's like, by the time I go to rollerblade, it's like I'm going super low, and it's like, come on, man, or like I'm going super high, and it's like what the heck? Like I don't get it. Like it's like it's like my body knew I was gonna rollerblade at this time, and then it wanted to just take this huge swing and shift. But I would say, you know, for everybody, but myself, I always try to put myself like in this space of like, okay, when is the last time that I haven't done anything? And I mean like completely bring my body completely still. Like no reading, no journaling, no editing, no talking, no nothing. And just kind of see, I guess, a form of meditation it would be, but just to see, like, can I just sit still for 10 minutes? You know, because the reality of it is like, it's tough to like unplug from everything. It's either social media or Zoom calls, or, you know, like I said, editing or in front of a camera or operating a camera. And it's like, just taking that time to just like actually disconnect from everything, because it's like you don't really get a chance to disconnect from diabetes unless everything is like kind of okay, it's running good. But I think like just being conscious of like just pulling yourself out the matrix and like just sitting, no TV, no nothing, and just sit there. Maybe you think or whatever, but there's no devices, there's no things like occupying your space or your mind other than your mind, you know. So outside of like rollerblading, those are, and like walking and listening to podcasts and reading, that will probably be one of the biggest things to just help me kind of just recenter and like completely disconnect from everything.
Yeah, thank you for sharing that. I think meditation is definitely something, and just being mindful of how we're feeling is really, really important and sometimes very hard. So I just want to normalize that. And then meditation too, personalizing it to you. Like for one person, it is like a mindfulness walk. So I'm just noticing what I'm looking at as I'm walking, or I'm paying attention to how my feet feel on the ground that I'm stepping on. For other folks, it is I'm like laying down on my bed and closing my eyes. Other folks have guided meditations. So there's no right or wrong way or a specific timeline that you need to have just to kind of ground yourself and relax your body. So thanks for sharing that. And here's another question for all of you. As far as mental health, how would you encourage other folks wanting to support someone with diabetes when, like, let's just say I see that my friend is struggling with her diabetes and it looks like it's impacting her mental health? Like, how would you maybe encourage that person to seek support, whether it's in a group setting or with a mental health provider?
I think that's a great question. It's also a very tough question to answer.
For sure.
In the sense of, you never want to be that person that's pushing somebody to do something and forcing them to do something. Because I'm a huge advocate. Like, nobody's gonna force me to do anything that I don't want to do. I don't care who you are. But it also is one of those things that if you care, you genuinely care and love somebody and respect them, and you see them getting thrown off, you want to help them. I think it's really just having an open conversation, and also maybe just voicing some things that you do when you're stressful. Because a lot of people, you know, they don't even know that they're stressed or they're going through things until you bring it up. But I'm also a type of person that likes to read people and understand them, and knowing if I'm saying certain things, is that triggering them? Because then if it's triggering them, then I have to take a different approach. So it's just really, you know, trying to, you know, well, you know, when I'm stressed, you know, I like to do this and I like to do that. And then kind of see maybe, you know, how they respond to that. You know what I mean? If they're open to it, then maybe that's where you kind of double click and then kind of dig a little bit deeper on, like, you know, maybe I've been noticing this, and I don't know if you want to try this with me. I always think that encouraging somebody to do something with you instead of just telling them to do something, I think they respect that a lot more. So I think always just, it's a two-way street. You got to kind of like, can't just force it, and I know that comes from parents, they do that with kids, like, well, I used to do it like this, so you got it's like, nah, it's a different day and age. You can't do that. We can't call them kids soft. They didn't grow up like you grew up, so they ain't soft. They just they do things in a different way. So I think it's really understanding who you're dealing with, and then kind of just giving them some options, and then trying to help them figure it out from there.
Mm-hmm. Yeah, and I think that's such a great point, because you don't want to say, I think sometimes people take it negatively when someone's like, I think you would benefit from therapy. They're like, what are you trying to say? There's something wrong with me. And instead of saying like, I've noticed you looking really stressed and I want to support you. Do you want to talk about that? How can I help you? So just even in that way, like using that type of language instead of saying like, you need to go fix yourself. Because I think sometimes that's the old perception of like, you need to go take care of you, instead of like, how can we resource you as a community? What can I do better to support you? Right. If we have the emotional bandwidth, because healthy boundaries are important. But what would you say, Crystal, as far as talking to someone, or maybe like what you wish someone would have told you?
Yeah, I think like in the early stages of my diabetes journey, I'd followed on social media, like diabetes influencers. And I remember seeing they had like perfect Dexcom lines. And I was like, why isn't mine like that? And so it's just kind of like what social media brings us, like I was ashamed and I was frustrated with it all. And so I would just explain like someone in my shoes, like it's normal to have like these challenges and they're inevitable. Like you're going to have days where you're high all the time, and you're going to have days where you're low and low and low and low. And no matter what you eat, it's not going to come up. And so I think like just understanding that, like, I don't have to, like, diabetes isn't perfect, like Lucy had said earlier. And so just recognizing and kind of like normalizing that. And yeah, I also really liked what Dawn said in the comments, like just listening and engaging in that reflective listening is so important, because then that person is able to really like get what they want to say out. And yeah, I think that's just important to get what's going on in your head just out into the world.
Yes, absolutely. Yeah, that like it's so important to listen. And I know the urgency for all of us that love the people in our lives and care for people we want to fix, and we want to jump into solutions. And maybe that's not where that person in our life is. Maybe they're just needing someone to listen or to give them some space. So thank you, Dawn, for that, for reminding us to listen, because I think it can be really hard when we have that urgency to fix. And I think I just saw a message from Casey that we're supposed to be wrapping up, and it's like we have less than a minute left.
Yeah.
Oh, I think Casey froze.
Yeah, technically. Oh, can y'all hear me?
Okay, we can now.
Yes. Yes.
Okay.
Sorry, yes, I was saying technically it ends at 3, but because we are the last session, if you wanted to take a couple minutes to just see if there's anything else that the panelists want to share, then you can go ahead.
Yeah, do you guys want to do that? Okay, and then also if anyone has any questions, we can definitely do that. I'm always happy to share resources. So, but yeah, were there any other thoughts that our panelists had that they wanted to just communicate?
I'd like to ask a question. I know we're short on time, but I want to flip this on Mary. What are some things that you see missing in I would say in the medical setting for mental health, for people living with diabetes in general, type 1, type 2, type 3C, gestational? What are some things that you see missing from
yeah, so I know in like in talking to providers, oftentimes mental health is missed. So when they're seeing someone struggle with like their time in range or their A1C, I think sometimes providers are really quick to judge their patients, right? Like oh, well, you're just non-compliant or this or that. So I think that that can certainly be a barrier for our community, for our diabetic community. And I really hope that folks are shifting to encourage asking folks about their mental health experience. I know that that's something that I don't see as often, and I know that there's certain inequities as far as access and barriers. I work with Spanish-speaking communities here in Southern California, and sometimes they're not given the same resources or the same access to the resources that I might know of or that you might know of. So I think that that's certainly something that all providers in the medical field need to look at. And so many things to learn about what diabetes is, not just numbers, not just prescriptions. But I do, as like at a human level, I really just think it's important for us to talk about how we're feeling and being honest about that with people that we feel safe and comfortable with, because I know not everyone has the ability to do that, right? Where they can hold space for us. So I definitely encourage advocacy when I'm working with folks with diabetes and learning what laws are. Especially, I know for me, when I'm working with Spanish-speaking folks that maybe non-residents or immigrants, right? Like where I'm like, no, you deserve this, and you can ask for this. And sometimes I don't see that happening enough, right? So. But I definitely encourage people to talk about it, and like what I said earlier, to say to someone when you see them that they're struggling, whether they have diabetes or not, to really just speak on like, hey, I'm noticing that you're struggling. I'm noticing that you've kept to yourself a little bit more. So you're like kind of noticing that behavior. And really push the sense that you want to help them, right? Not push them to get services, because we can't push anybody. I know sometimes when people come to work with me as their therapist and they're like, just help this person get over this situation, or I want you to fix this. Like if someone doesn't want the support yet, a therapist isn't going to be able to make that shift if you're not open and ready. Right. So I think that that's an important thing to hold, especially if there are any parents in the room, or we have a partner that really could benefit from mental health supports, but they're not ready for it. So just to keep that conversation open and be that resource for that person as best you can.
Thank you.
Yeah. And was there anything else that anyone wanted to share or ask as we're wrapping up our call?
Yeah, I
Well,
can share. Oh,
sorry.
Go ahead.
Okay, well, I think that not only do we have to destigmatize diabetes, but we also have to destigmatize mental health care and therapy, because it's still a taboo. You don't go to therapy because you're crazy. You go to therapy because you're taking care of your health. That's it.
Yeah. I agree with that, because I think what is awesome about younger generations, and they just like are so casual about it. Yeah, I have a session with my therapist tomorrow. Whereas other people and maybe perhaps older generations would want to hide that. So I love that shift with younger folks in this world where they speak about it. Yeah, they speak about it like, I'm going to the gym, I'm going to therapy, I'm going to see my endocrinologist, and that's just natural, as it should be. And I think, Crystal, you were going to say something.
Yeah, I just wanted to share what I said in the chat, that something from my undergrad study on young adults living with type 1 in the US. When they were asked about what topic they want the provider to address more often, the number one topic was diabetes specific stressors and diabetes burnout. And then the next one closely followed was mental health. And I think that just really highlights the importance of what medical professionals need to do, like not just focus on the numbers, because I think personally that was what was the focus of my appointments, like setting all of my getting my diabetes tech all organized, making sure my numbers were all good, but what about my mental health? Like, yeah. And so I think it's important to focus on that too, and not just our numbers.
I would agree with that. Yeah. And just like normalizing those conversations of being open about how we're feeling. And even just sharing, you know, like, oh, I had a really great experience of therapy. And even just to further say, like, when we're looking for a therapist, there's like awesome directories that are culture specific, ethnic specific, which I think is very essential for our mental health. And then also just even treating those consultation calls with therapists as like an interview, like ask them what you need to ask them and pay attention to how you feel in those conversations that you're having when you're consulting with a therapist for the first time. And because I think that that's so important, and you don't have to work with the first therapist that you call. I know, and for those of you that are in the US, normally you do a phone consultation with a therapist before you start therapy, and you don't have to make an appointment if that call wasn't comfortable, right? So just even paying attention to that, I think, is really, really important.
I guess I'll come off and ask a question, kind of in association to what you guys are talking about. So are there any resources that are specific for people with diabetes, like to find a therapist who has more knowledge about diabetes than like the general therapist may have?
Yeah, so I know that I'm a therapist and I have type 1, but there are a lot of therapists that specialize in doing somatic work, which is body work, and there's therapists that specialize in working with medical trauma. So if you have trauma related with diabetes, or your experience of diagnosis or whatever that looks like, those are two key words to kind of look at when you're looking at directories. Because a lot of therapists who don't have a chronic illness or don't have type 1 diabetes do great work with working with people with chronic illnesses, especially those that are somatic therapy trained, which is like just a really great way to learn techniques to learn about how to feel good and safe in your body, and how to ground yourself and how to connect. Kind of like what Lucy was saying earlier, like I'm learning to pay attention to my body and feel safe in it and feel good in it, even when I'm not happy with parts of my diabetes journey or my experiences of the day. Those are two good things, again, to look at, keywords or questions to ask. What is your experience of working with someone with a chronic illness, with type 1 diabetes? Do you do somatic work? And I know, like, when you're on search engines for therapy directories, you can look at, sometimes it allows you to type in depending on the directory you're looking at. So you can put medical trauma, you can put chronic illness, you can put somatic therapy, and those therapists or psychologists or clinicians tend to understand the body a bit more. So that would be like a really great resource to kind of look at, or a question to ask whatever provider that you're interviewing, because definitely interview away. Ask whatever question that you need support with, and you can ask the therapist, like, how would you help me in my experience of anxiety with diabetes, or whatever the situation is for you.
I'm just checking out the chat. I see
Okay.
that a lot of people are dropping good links. So Dawn dropped the ADA directory
Yeah.
for our mental health providers who have completed a certification course. So
Mhm.
good links there, people. And also, I just want to say, whoever is beeping, that is the first beep.
Oh, that's me.
I'm so glad you are.
It's gonna
Because that's the
expire.
first- I love it, because I'm like, this is a diabetes conference and no one has beeped. So thank you, Mary.
It's reminding me that it's going to expire in a couple of hours. So
That's so funny.
yeah. All right.
Awesome. Well, if there, yeah, does anyone have any other questions before we wrap up? Y'all can come off mute, type in the chat, whatever you're comfortable with.
I would just like to say thank you guys for allowing me to participate today. Quisha and also Casey, appreciate you guys very much, and everybody that joined, and then also the panelists as well.
Yeah, thank you for having me. It was nice to be a part of it this time.
Yes, thanks for having me too. I had a really nice time.
Yeah, so did I. I really appreciate being part of this group today, and you're more than welcome. Anybody that's here today, you're more than welcome to email me, and if I can't work with you directly, especially if you're out of state, I'd be happy to connect you with resources or directories to support you, what you may need, or connect you with someone else that might have the answer for you.
Yeah, if we want to go around, the panelists drop where we can connect with you, like either your email or social media, then let the people know.
Yeah, and while they're doing that, I just want to say thank you all so much. It's so, I think people get, and this is why we continue to do this every year, people get the most out of hearing from the lived experiences of others. And I think it provides them with a different point of view. And we have, we've got healthcare professionals here, we've got patients also, and we've got, just people that are curious and interested. And thank you so much for your transparency. And I mean, it's just, it was yesterday, I think, Erica with DLC, is it DLC, Diabetes?
Leadership Council.
Yeah, Diabetes Leadership Council, that said we have to do better at sharing real people, real stories when we're talking about trying to make any kind of change when it comes to diabetes policy and advocacy. And so that's what we really want to highlight more than anything is letting people share their stories. And so we thank you so much for sharing your realness. We really appreciate your involvement this year.
Yeah. Well, thank you all so much. This concludes it. The People of Color Living with Diabetes Virtual Summit 2022. Such a great time, such a great time. So thank y'all panelists. Thank y'all everyone who has hung with us since yesterday, and people who've been able to join throughout. So I've had a great time, and I hope everyone else has too. So
this was wonderful. Thank you so much.
For sure. Well,
Thank you.
Bye, everyone.
yeah. Bye everyone.